Hey everyone, happy Monday. Just wanted to talk to you about some post-operative instructions after a dental extraction procedure. We have a guideline that we follow, so I figured I'd just read off to you guys the guideline. It's a little bit easier to watch a video than to read a sheet of paper, okay guys? So if you had a dental extraction, whether it's wisdom teeth or a single tooth, first off is this: with the bleeding, we always have you bite down on a piece of gauze. So this piece of gauze, we want you all to bite on it for about 45 minutes to an hour, holding it in place with steady pressure. So just constantly bite on it. There will be slight oozing. The biggest thing is a little bit of blood with a lot of saliva. It looks like a lot of blood, but that's not necessarily the case. The gauze should kind of have a slight pink tinge to it. In terms of activity, we want you to take it easy for a couple days. No forceful spitting, no sucking through straws, because this can dislodge the clot and sometimes cause dry socket, which no one wants to ever experience. In terms of swelling and discoloration, anyone over the age of 25 just heal slower. Sometimes if you're fair skinned, you'll bruise a little bit. That will resolve in a couple days. If you tend to be a little bit older, sometimes you can have bruising throughout the neck down to the anterior chest. That's completely normal. You can always follow up with your surgeon in terms of if that's okay, but that is normal. It's a variant of normal. In terms of hygiene, we want you to brush your teeth normally. You can use saltwater rinses. Sometimes we do prescribe what's called Paradex rinse. It's a specialized mouthwash that kills the bacteria inside your mouth. In terms of diet, we want you to eat whatever you can tolerate. Maybe for the first day, you can do grits, mashed potatoes, milkshakes without a straw, and scrambled eggs, soups, stuff like that. But basically advance your diet and try to partake in a normal routine. And the last thing is with sutures. The stitches that we use do dissolve on their own. They can range from 3 to 10 days. I know that's a big range, but basically they'll fall out on their own. Sometimes you may have to just pull them out, but for the most part they'll dissolve on their own. And then the biggest thing is if you experience any type of unusual symptom or you're kind of worried, always give your surgeon a call and they can kind of walk you through the post-operative phase. All right, guys, thank you for everything, and happy Monday. See ya.